Hi everyone, and welcome back to my channel. My name is Angie, and today I'm going to be continuing with my story. So if you haven't already, like and subscribe. It really helps the channel. Appreciate it. So what I'm going to be talking about today is kind of most recent what's been happening with me. Basically my complications after my last immunotherapy. So I finished my last radiation in early January 2024. I think my last one was January 13th. I will be doing the radiation video coming up pretty soon here, but I wanted to kind of get this one out of the way while it was still fresh in my mind, because it's basically things that are happening right now. So today is March 20th, 2024. So I'm going to go back to, so I was on my way basically recovering from radiation back in January. Everything was good. I'd gotten back into my exercise therapy program. I was trying to get a little bit stronger, thinking maybe getting back to work in the next, 4 to 6 months or whatever, however long it was going to take me to feel strong again, my regular self. I had another immunotherapy around, it was February 13th of 24. I didn't have any reactions, no issues. Just kind of went about my day that day. Around February 14th, Alan Blair called, and they noticed something from my blood work. That my thyroid level was very low, and they basically said, we'd like to take you off your thyroid medication. I think my level was like 0.01 at that time. So they said, stop taking your thyroid medication for about 2 weeks. We want to see if it kind of clears up. I've been having some symptoms in that time from basically the last immunotherapy on. I was feeling really tired all the time. I had brittle nails. I had insomnia, and some constipation, brain zaps, spins, not necessarily really dizziness, just like brief brain zaps kind of thing. I was feeling cold all the time, like not shivering, but just uncomfortably cold, like before I would get my regular hot flashes, and I knew things were, par for the course is normal, but my hot flashes kind of stopped. So I knew something was up. I didn't have any fever, nothing like that. I didn't know what was going on, but I knew something wasn't right. Then I actually went to my local hospital. I had a hospital stay from February 24th to 27th at my local hospital, the one that's only about 10 minutes away. I really wasn't feeling well. And this wasn't my Alan Blair center. It wasn't the cancer center. It was just our local hospital. So I was feeling really weak, dizzy. I couldn't really take 5 steps without having to sit down. Having a conversation with you sitting down, I would have to take a breath between like 2 words kind of thing. I couldn't get enough energy to even speak. And I felt kind of like I was going to pass out. I was kind of seeing like floaters, and my vision was a little fuzzy. So I went to the emergency room. I was put into a room fairly quickly, and I was examined. They took a CT of my chest. They did blood work. And the ER doctor suspected that I had internal bleeding at that time. They didn't quite know what was going on. They figured, oh, well, her levels are low. The blood has to be going somewhere. We have to kind of figure out where it's going. They thought maybe I had a upper or lower GI bleed at that time. My hemoglobin was at 75. Normal range is 120 to 160. And my platelets were at 60. And normal is about 150 to 400. So I wasn't doing well, to say the least. So I was admitted under a general surgeon who wanted to do an upper GI scope and a colonoscopy, just to try and find where this suspected bleed was. So yeah, I was basically admitted to the hospital. I got my own room eventually, so that was nice. So I was given a drink to prep for the colonoscopy. It's like a clean out that they have to do of your insides, your intestines kind of thing, so that they can get the scope up there and see things clearly. So I was given like I think it's called Pico drink. Basically, you have to drink like 2 liters of this stuff and with water in like a 12-hour period. I can't remember. I don't remember. I was drinking a lot of liquid and going to the washroom a lot. So I was very thankful that I wasn't still in emergency for that part, because the emergency rooms in our hospital don't have their own bathroom. It's kind of like when you have to go down the hall and share. So I'm very thankful that they were able to find me a room and I was able to have a little bit of privacy for that part. It's not the best thing to talk about, but it's my truth. So I just wanted to get that out there. So, so while I was doing my clean out and everything, I was also given a blood transfusion because my numbers were so low. They had to do something. So they did give me, I think I got 2 blood transfusions and 1 iron transfusion for that short few days stay at that local hospital. So that did help with the blood counts. It kind of helped perk me up for a little bit. I'm going to say I didn't have any extra medication at that time. It was just the blood transfusion. So that would perk me up for about 12 hours. And I felt brand new and I felt like I had energy again and I could speak okay and everything just went back to normal. So I was feeling wonderful after the blood transfusions. I will say a huge thank you to whoever donates blood. I mean, I would have been in big trouble if that wasn't available. So it's people like that donate blood that save the rest of us. So I do thank you blood donors out there. So I went through the 2 scopes. They did those. I was lightly sedated, which was good. I didn't feel anything. I went lightly to sleep kind of thing. I woke up in recovery and I was brought back to my hospital room. The surgeon came in afterwards and the results from the scopes turned up that there was no internal bleeding, in fact. So they didn't really have any answers for me. They did basically what they knew how to do. I was given my 2nd bag of blood on February 27th. The surgeon who did my scopes came in and yeah, she said my case was kind of out of her expertise area. And she basically said there was nothing more she could do for me at that particular hospital and to follow up with Alan Blair if I'm still not feeling well tomorrow. At that point, I was feeling pretty good because I think I had just had the blood transfusion a few hours before. So I was feeling not good, not too bad. And I think they felt okay that I was stable and they could release me and I could kind of try and seek out help if I needed to the next day, because they kind of didn't know how to treat my case. My local hospital, it's not like a special cancer hospital or anything like that. So they weren't quite sure what to do with me, so they just sent me home. So I think I will end that right here. I'm going to have to do a part 2 and maybe a part 3. So I thank you guys for joining me for this one, and I will see you in the next video. Bye!